On this World Health Day, we take a moment to hear from those at the heart of our healthcare system that struggle and triumphs, paint a picture of a system that is both challenged and full of hope. Now, is this your first time of being in this place?
No, this is not the first time.
This is not the first time. How satisfied are you with the quality of healthcare you get in this place?
Honestly, I'm not satisfied because I've been on queue for the past 3 hours, and my wife has been there waiting. She's pregnant, and you know, anybody that you see here needs an urgent attention. So I'm not satisfied because we needed more pay points to save people from staying much longer on queue and all that. So I'm not satisfied at all.
Nigeria before. What are the major challenges you face in accessing healthcare or receiving healthcare here in Nigeria?
You know, challenges is equipment. Most government hospitals don't have equipment. They whether refer you to private facilities or something like that. They don't have equipment.
How affordable is healthcare for you in Nigeria?
In fact, it's not affordable for me.
Like, how much do you spend here for healthcare?
Yeah, I could remember last time I came, I paid 4,000 naira for running a scan.
They are cheaper compared to private hospitals.
Yeah, so the subsequent one I came, they said it has increased to 8,000 naira. And you know the situation of the country is not okay. So I was annoyed. I said, how can the increment? It's very outrageous.
If you have the opportunity to change the thing in the Nigeria healthcare system, what would that be?
They should improve on equipment.
If I have opportunity to change something in the Nigeria healthcare system, I will try and make sure that both in the rural and urban access health offices.
Behind every patient is a healthcare provider working tirelessly to make a difference. Now let's shift our focus to the healthcare professionals who are on the front line of Nigeria's healthcare system. As a health professional, what are the pressing health challenges you face in the discharge of your duties?
Alright, because of my practice as a nurse, I happen to have come across a lot of challenges as a nurse. First and foremost, the most pressing challenge I may say that I have come across is work overload. In the part of the country where we find ourselves, nurses are being overworked. When you compare patient to nurse ratio in the hospital, you know that it's quite in an alarming rate. Another challenge I face as a nurse through the course of my practice is the issue of underappreciation. What do I mean by that? When it comes to low salary payment, nurses are being underpaid in this part of the country.
As a health professional, how do you think we can better educate Nigerians on how to prevent certain diseases like HIV, tuberculosis, and even malaria?
To better educate the public on the prevention of these diseases, there's need for us to, collaborate with the community leaders, not just the community leaders, religious organizations or religious leaders, to pass information on health prevention in our society. Another means is by inculcating or collaborating health education curriculum into our school curriculum. By so doing, the children will be well, educated on ways to prevent these illnesses.
Lastly, in your own experience as a health professional, what are some of the barriers to accessing healthcare in Nigeria, and how do we overcome these barriers?
Well, the barriers in accessing healthcare in Nigeria could be the distance from the rural area to the health facilities. Again, another barrier in accessing healthcare system is cultural diversity. For example, in the northern part of this country, many women do not have that freedom, in quotes, to access health facilities. Most of them will have to wait for their husband's permission because of maybe their culture before the husband could permit them to do so. And so for us to, overcome all these barriers, or for us to limit all these barriers, I think one of the things that need to be put in place is providing necessary or adequate infrastructure such as transportation system, such as building more health facilities within the communities, so that these people will have access to all this. People have to be enlightened, people have to be educated, because ignorance is another barrier to getting access to healthcare. And